How much does it cost to travel the world for medical insurance, medical expenses, prescriptions, and all the wellness that you need as full-time travelers? We're going to expose all of the monies we spent taking care of our health this year as we traveled around the world. Isn't that exciting?
It is. It's exciting. Yeah, health insurance. Yay! Well, this is Chris and I'm Steve. We're EatWalkLearn. We have been traveling around the world for the last 4 years, and this is a really exciting time of year for me, especially because I'm the numbers guy. I love to crunch the numbers, and I love to share with you what our costs were. And so you can kind of get some ideas and some exposure on what it might cost you to be a full-time traveler. But health insurance, I think, is the number one question.
Number one.
The number one talk about our health care in general. And we've got a lot of little, things that we've learned this year. It's changed every year for the 4 years that we've traveled. We think we've kind of got it nailed down.
And then they'll change it again.
this year, and really excited to share with you. So we're going to share with you all the costs of our health care and of our insurance, and if it worked, if it didn't work.
How we filed claims, how we didn't file claims, and just get down to the nitty-gritty of the numbers. When we left Denver in May of 21 and we had sold our car and our house and put everything in our 2 carry-on bags, I wrote a book about 2 carry-ons and a plan if you want to know how to launch. We have another book, Nomad Life, which is the life of living a nomad. And then a third book coming out where we interview full-time travelers about how they do all the things we're going to talk about. Anyway, when we launched back in May of 21, our biggest question was how, Steve, we were on Steve's employer's insurance and he was retiring. Well, what was going to happen after then? Every year, our situation has changed. And you can watch our video up here about all the ways we've had insurance over the last 4 years. We're going to talk about insurance this past year.
We started our travel on June 1st.
Right.
So we do a June to May is our year. So now here we are wrapping up our 4th year of travel. So it overlaps a couple of calendar years.
Yeah, so the numbers may look a little wonky when you try to do it by the month. So just hang with us as we try to explain the story. So let's start off with our ages. I am 58. Steve is
65.
Right. Woohoo! So you know what that means. A lot of you Americans know Steve turned 65, so he went on Medicare in April. Right. And in the United States, I carry ACA or Obamacare. Now, because of and Steve was on Obamacare as well at that time because he wasn't yet 65. So, and because of our income categories, and we're based in Texas, we're able to qualify for a no premium amount Obamacare or ACA.
And recognize that ACA is different for everybody. It's different by state. It's different by county. It's different by what your income situation is. So this is not a one size fits all. It just happens to be for us, for our situation, since we are retired, but young enough, we fit into that category where the ACA plan, Obamacare, is a perfect solution for healthcare while you're in the United States.
Right.
But
and for us, our premium is zero. So it costs us nothing. Now, we know it's not free, but it costs us nothing out of pocket. Now, when we go internationally, again, we're not so interested in whether the U.S. is going to cover us. We go ahead and get an international medical policy. Now, I get Genki, Genki. I'll put you links here. Please follow our links. We get a little kickback. You get a little kickback. We all win if you follow our links. And Genki covers both of us, or was covering both of us, outside of the U.S., everywhere but the U.S., I think Canada and Singapore, or something like that.
Yeah.
Anyway, so we did all of that up until April. We were still outside the country. Steve dropped Genki and ACA because Medicare came up and took over for him. I am still on ACA and Genki. So now that you understand kind of where we are with insurance, we're going to tell you what it costs. So our first line item on our categories for health and wellness is health insurance. Last year, we paid $3,126. What did that include?
For Chris, it's about $120 per month. And for me, it was $175 per month.
And this is full medical coverage outside the U.S.
Right.
Now, when Steve dropped his Genki in April and went full onto Medicare, the $175 Genki dropped and went away, but his Medicare came in at $123.
Right.
So you got a $50 raise by going on Medicare.
Yeah, and we did. I did a video on that one. If you want to watch that, on how my Medicare premiums are $123 a month. Again, it varies for everybody. This is my situation. So what I'm doing is I'm relying on my Medicare coverage, which has an emergency provision for outside the United States.
Okay. So I think the point that you're trying to make was your Medicare does give you critical coverage like the ACA did outside the U.S.
Right.
But now because Yankee, since you hit 65, all of the medical care providers have become very expensive. So Steve is now looking at paying out of pocket for any care he might need out of the U.S. or having to go back to the U.S. for care that he would be covered under Medicare.
Well said.
Okay. All right. So next item we're going to cover, and stay with this because we're going to get into prescriptions, cost of prescriptions, how we fill them, and other expenses and doctors. Next up was miscellaneous health. Miscellaneous health the bucket is $641. What's miscellaneous health include?
Yeah, so it's interesting how low this was because this includes anything related to health that's not like directly. So things like massages and Band-Aids at the drugstore and
aspirin.
Even things like, haircuts and
haircuts are in there, okay?
and things like gym memberships and things like that when we wanted to do things. So it's kind of a catch-all. It's like, oh, this is related to my health and wellness, but it doesn't really fit into a category. It's not
and
direct.
Clearly you did more haircuts than I did.
just a couple more.
Okay, the next one, prescriptions. Okay, this is a big one. So the number is $228, how much we spent on prescriptions.
Yeah.
But what we're going to talk about is what that means. So do you want to talk about your prescriptions? Or you want me to talk about my prescriptions?
So, we're going to tell you a little bit about our health and wellness exams that we had in Turkey. But let's kind of cut to the chase. As a part of that, for the first time in my life, I was prescribed some medications. And for all you guys out there, we're going to talk about prostates. And so it was actually really easy to get my prescriptions filled in Turkey. They kind of wrote out the prescription for you. You took it to the pharmacy. They handed you the prescription. It was fairly low cost because I'd done some shopping around in other countries as well. Got the prescription, and then they hand the prescription piece of paper back to you. And it's like, oh, thank you. Okay, so now I want to refill it again. I just take the thing to the next one down the street and they filled it again. So I was able to, as a nomad and as a full-time travel, get some months of supply of this prescription that I now had. But then we found out a few months later, we're now in Argentina, in Buenos Aires, Argentina, really far away from Fethiye, Turkey. And my prescription that I have, the piece of paper, is written in Turkish. It's not going to do me a whole lot of good in Argentina. So what I did, and I've used this before, is there's an organization called Air Doctor, and it's an online video doctor. And I'm going to run this little video while I explain this. It's really easy to go online, and you can log in, and it automatically knows where you are, where you're located. You can tell it what kind of doctor you want. Basically, you want a video chat. You want a general physician, and then it gives you the list of the doctors who are in your area. And there's a variety of choices that you have. So if you need some immediate help, there's a choice there that's a little bit more expensive because the doctors actually choose their own fee. And then you choose the doctor that you want, and you can make sure that through the filters that this doctor not only speaks English, but they can also fill prescriptions in the country where you are. And then just go through a couple more steps, and you can schedule your appointment with a video chat with this doctor. So I actually had this exact experience while I was in Argentina. I got a video chat with a doctor. I told him my situation. I needed some prescriptions refilled. Within minutes, I had the prescriptions in my inbox, and I was able to take that prescription to the pharmacy in Buenos Aires and get it filled. So this is a question that comes up a lot. And this is why I wanted to demonstrate how easy it is for you to get prescriptions filled while you're
And that's
overseas.
just one example. Another example is we were in Aruba. You had some cough thingy, and we went into the pharmacy, and there was a doctor on site, and he said, you need a script. And so he says, for $40 extra, I'll just write you a script. So he wrote the script, and we got the meds. Other places, it has been, we've just walked in and, we talked to the pharmacist and we said, this hurts, or showed a prescription, and they just filled it. They didn't require a new script. They didn't require any sort of anything. So getting meds around the world, even though each country varies about how to do it, it has been very easy to do it. We've never been refused our ability to get any meds that we've needed.
But again, disclaimer, everybody's situation is different. We're not going to say that your medication is available in all these countries and how easy it is to get. Mine was is a prostate medication. It is the most widely prescribed drug, I think, in the world. and so it's readily available, and it was easy to get it filled. And
then they're also cheaper too. Let me give you an example of, we'll get into the health screening, which is the last category in just a second. But the bottom line was, I thought I had the glaucoma. I don't have glaucoma, but I was in Turkey and was able to fill some glaucoma meds. They cost $2.50 for about a 3-month supply of drops. I bought 6 bottles. I think it was a year. I bought a year's supply. And then I found out after using a half a bottle, I don't have glaucoma, and I had 5.5 bottles left. Well, I threw away the half bottle. The 5 bottles I had left, a friend of mine that I was going to see in Mexico, needed the prescription, and she had the same prescription, and she needed the meds. I gave them to her. Instead of her paying $250 for the same medications, I gave them to her for free because they only cost me $2.50. And what a gift I was able to give her. So
medicines are more as available and cheaper around the world. Again, your situation may vary from ours,
but we have lots of examples of that being true. So, okay, the next thing that we keep on talking about and we keep on alluding to is health screenings. So what does this mean? There are several facilities around the world that you can call, you can make an appointment, and they'll take your money and will do a complete body workup of you. This is all your bloods, do cancer screenings, cancer markers. You'll get to see 7 to 8 specialists in one day. They do all the testing, they do all the analysis, they do the sonar and the EKGs and the EUGs and the IMUs and whatever. At the end of the day, they give you a report about what your health is, discuss it with you, and then if you need to go see a specialist after that, they'll make an appointment for you to see the specialist the next day.
Yeah, in my particular case, again, let's talk about my prostate. So I was very interested in seeing a urologist and a cardiologist, and this was all included in the health screening, and not just a visit to say, how are you doing and take your temperature, but this is a full sonogram of all of your internal organs. And, like Chris said, they do the EKGs, the stress tests. There was the one that we did in KL, did a bone density. Yeah.
So we've done 2 of them. We did one in Malaysia, in Kuala Lumpur, which we did a couple years ago. You can watch the video up here. And we also did, the most recent one was in Fethiye, Turkey, last November, I think it was. And we actually did a video comparing them. The bottom line was you see 7 or 8 specialists that cost $400 to $500. At the end of the day, you've got your report. The next day, you had to go see a specialist. Right. I had to go see a specialist, and that's where the glaucoma came in. Now, I'm going to talk just a minute. So first of all, the cost of the health screenings, the cost of the health screenings was $1,576, which included not only the health screenings for Steve and me and Turkey, but also the additional specialist visits afterwards.
Yeah, and let's make the distinction. So the general health screenings is not in something that you can submit to insurance.
Right.
So but the specialist visit for a particular, symptoms, a particular case, so that was an event. The follow-up was something that we were able to submit to Ginkgo for reimbursement.
So let me talk about my particular situation, which will help clarify this. You'll see better after this. So a couple years ago in Malaysia, we did the full health screening. In the health screening, there was an ophthalmologist. The ophthalmologist thought I might have glaucoma. They ruled it out, but they wanted me to keep an eye on it. So 2 years later, we're now in Fethiye, and I'm having my keep my eye on it appointment at the ophthalmologist. And that ophthalmologist says, I really do think you've got glaucoma. Let's start medicating you for it. So in the health screening, the ophthalmologist said, I want to see you and do some more testing. So that was the next day. on a extra appointment. That appointment I submitted to Ginkgo, and they reimbursed me. Ginkgo is a €50 per condition copay.
Deductible.
So also in that visit, I saw the ophthalmologist. She sent me over to the hospital nearby. They wanted to do a brain scan to see what was happening in my eye. I got a brain scan at the brain MRI and saw a neurologist. And after all that, they said they thought I had glaucoma. So I submitted the brain MRI, the neurologist, and the ophthalmologist to Ginkgo for under one visit, and it cost me €50, and they reimbursed everything else, $300 something, whatever.
Yeah, which to make a point. This is a big deal because this was hundreds of dollars. In the United States, it would be tens of thousands of dollars.
Yeah, for a brain MRI.
Reimbursed almost 100%, except for a $50 deductible.
Right.
Was completely reimbursed by Ginkgo.
But let me just continue the story. Yeah. So the Turkish ophthalmologist wanted me to do a follow-up in a month. Well, I wasn't going to be in Turkey. I was going to be in Argentina. So I got to Argentina. I went and saw another ophthalmologist, and she looked at all the records and all the reports, and she's like, I don't think you have glaucoma. I just think you've got a defect in your eye. So then I went through another battery of tests, a whole day of tests on my eyes. And every 2 hours, they did dilation. Anyway, I don't have to go into how the sausage was made. At the end of the day, after 7 or 8 different tests, they finally determined I just have a defect in my eye and is not glaucoma. So I submitted all of that also to Ginkgo, so as a second iteration of a submission, and they paid...
But was this still the same condition?
The same condition. They paid 100% of all the extra stuff that came over from Argentina. So the problem started in Malaysia, it was diagnosed in Turkey, and then it was treated and undiagnosed, I guess, in Argentina. So across the world, I was able to continue doing my continuity of care by sharing my records with everybody. In Malaysia, I was on different insurance. I just paid that out of pocket. And then in Turkey and then in Argentina, I was on Ginkgo and I was able to submit that. So for all of you who are very concerned about your continuity of care across your conditions, here's a great example of how I've been able to manage that. And of course, my Argentina doctor has said, please make sure you follow up again on your eye in another year just to make sure we're not wrong on this. I'll just bring all that forward to my next doctor. So $50 from €50 from Ginkgo for probably $500 or $600 worth of medical care on my eye.
Yeah, at least.
Yeah, and then you did a submission on your prostate and another condition that you had, and we've had no problem whatsoever. They have paid, and they paid usually within a week. I think you had a 2 weeks on one situation.
2 weeks, I think.
Brilliant. And they just deposit it right into your checking account. So that was lovely.
Okay, so
the total cost.
Lots of twists and turns here. We talked about insurance. We talked about miscellaneous. We talked about prescriptions. We talked about submitting, claims to the insurance company and the health screening. Let's look at the total.
So the total for all our health and wellness for the 4th year of travel was $5,571. So $500 a month.
Yeah.
A year for the year, $500 a year for the both of us to have full-time health, wellness, and care around the world. That's pretty amazing.
Yeah, and I have to say that feel great. I feel like we've had really good quality medical care. This past year, I feel confident with our insurance that we're going to continue to have a good level of coverage, and hopefully, we shared some tips here that you can take with you on your travels. Yeah,
and use our Ginkgo link if you would, please. Thanks for following along. We've got one more video in our expenses coming up. It's next week. You will see the totals of all of these numbers and whether we're on budget. But in the meantime, watch our accommodations video and watch our food video. If you missed the food video, go catch that. We'll see you next week. Thanks for following along. Ciao.